Tonight's program is being sponsored by the Donald F. Kent Memorial Fund. Donald F. Kent, MD, PhD, was a physician, teacher, and mentor. Dr. Kent was born October the 4th, 1913 in Newark, New Jersey, and grew up in East Orange, New Jersey. He received his BA and his MD degrees from the University of Pennsylvania. He had a private practice in Chatham, New Jersey, and was a founding faculty member of the doctoral program in medical humanities at Drew University. He was one of my professors. At the age of 95, he was still teaching a course in the history of medicine. Dr. Kent was a longtime regular attendee of the society meetings and presented papers at several of the meetings. According to past president Dr. Richard Marfuji, and I quote, "As history recounts the narrative of lives well lived, we can take pride in knowing that one of our own has set an example well worth remembering." The Dr. Donald Kent Memorial Lecture was launched for the Society in 2013 to honor the memory of Dr. Kent. These lectures are presented once a year. Here to introduce our speaker tonight is the Society's Vice President, Dr. Robert Lahita.
Thank you, Linda. It's a great pleasure to introduce tonight's speaker, Dr. William Frishman, who is the Barbara and William Rosenthal Professor of Medicine and Chairman Emeritus of the Department of Medicine at the New York Medical College, Touro College and University in Valhalla, New York. I have known Dr. Frishman for over 30 years, I think he would agree, and he is going to talk to us about a most timely topic tonight, being the night before the inauguration of our 46th president, Joseph Biden. I just want to say that having a position as a president of the United States has been described as one of the most dignified jobs in the history of the world. The idea that a position of leadership that was not granted by appointment from a predecessor, but by the process of democracy, has clearly come to popularity over the past centuries. However, the question arises, should there be more than just slogans, planned campaign trails, or a good record to win the people over? A discussion about presidential health has been very, very popular over the past few years, particularly so during the 45th president's term of office. Should the presidential candidates and the current president that is to be revealed to the public? As any other citizen in the United States, the medical records remain private, which is a right protected by law. We've heard about the 25th Amendment of the Constitution repeatedly in the past couple of weeks. We've heard a lot about the current president, the 45th's health, and possibly the health of the incoming president. And again, Dr. Frishman, who I've known for many years, gives great justice to this topic. He is very well-versed in the health of the American presidents going back to Washington. And so without further ado, I want to introduce my good friend and colleague and our distinguished Kemp lecturer for tonight, Dr. William Frishman. Bill?
Okay.
It's good. It's good.
Yeah, thank you for the opportunity to speak to you tonight on this evening before a changing of the guard in the White House. I would like to thank Dr. Lahita and the Society for inviting me to give the Kent Memorial Lecture tonight. This is an area that I've had a great deal of interest in. I'm a cardiologist, and I've had the opportunity through various experiences to interact with many of our past presidents. It really sort of came through my military background. I was actually stationed in New Jersey for part of my military time in Fort Dix, but have been involved also as a civilian consultant in cardiology for the Army. And through that interaction, actually was able to interact with some of the presidents that I'll talk about tonight. But I really want to give a history, and really the main focus of the talk. Next slide, please. Next slide. Yeah. Is really how the health of the presidents impacted on American and world history. One of the things that, and that Dr. Lahita mentioned it, is the sort of the secrecy, the air of secrecy that took place regarding presidential health, not wanting to scare the public if the president was impaired. And this has had tremendous implications in American history. And the role of physicians to the presidents, both civilian and military, because this is important, they were conflicts and cooperation. But in fact, the president has military physicians assigned to him, and the vice president and her. There are 6 of them. 2 are from the Army currently, 2 from the Navy, and 2 from the Air Force. And Sean Conley is currently the presidential physician, has that title amongst the 6 physicians. We'll also talk a little about the 25th Amendment that almost got brought forth last week regarding the trouble in Washington and how a president can be removed. Also, something which the vice president can initiate with the cabinet, but the current vice president didn't want to start a process, at least while Trump remained president. And then the history of medical care of the presidents did not always mirror the history of medical care in the United States. Next slide. Now, just some case presentations quickly, and this is public information. So this is not a violation of HIPAA. This was actually a part of physical exams that were published in the newspapers. But who is this individual? Had a strong smoking history. He talks about it in his recent biography. And these are his lipid values. His total cholesterol is 173, triglycerides 44. Who is this?
Obama.
Yeah, right. Go ahead. Next slide. Obama. Next slide. This is another individual. 20 years ago, had a ruptured berry aneurysm, outgrowth of a blood vessel in the head, which ruptured, causing headache and coma. The individual was operated at Walter Reed Army Hospital, had complications related to the operation, required another aneurysm to be clipped. And these are his most recent lipid values, and he's currently taking a statin drug.
Biden.
Next slide. Joseph Biden. Next slide. And finally, this history has no history of smoking, no history of alcohol consumption. It takes rosuvastatin, aspirin, finasteride, a drug to try to preserve his hair. He has a pulse rate of 63, a blood pressure of 120/79. He's 6'3", has a body surface area of around 29, and his cholesterol is 196, and it's come down from 227. Who is this? Next.
Trump.
Slide. Trump, yes. Trump. Next slide.
Okay.
This was his physician, and this was also published during a recent physical exam of Trump, where his health was described as astonishingly excellent, and no American president has been in shape as splendiferous as Trump. I don't know if splendiferous is a word, but it was used to describe Trump's health. Next one.
That was his podiatrist.
Well, that's another issue, but we'll talk about that. This is Sean Conley, the presidential physician, who, by the way, is an emergency room physician in the Navy. I mentioned there are 6 physicians, 2 Navy, 2 Army, 2 Air Force. One of the 6 is designated as the official presidential physician. The presidential physicians travel with the president, with the first lady, with the vice president, and now the second man, who is going to be the current vice president's husband. But this is actually Sean Conley. And I'll talk a little about the traditions regarding the military physicians. Next slide. This quickly is, this is when I was in the Army. Next slide. That's how I sort of got involved in this. And again, I got to know many of the physicians. This was related to a program we did with the White House years ago. This was George Bush's father. The next slide. and a telegram from him. We were involved in a program which really was set up by the government, which was to bring together, as the Cold War was coming to an end, all the astronauts, all the cosmonauts from Russia, all the Russian space physicians, and all the American space physicians. It was held in the United States. It went on for 3 days. It was very, very successful. And we don't get emails anymore. We didn't have emails years ago, but this is from George Bush to us. Robert joins me in sending best wishes for a productive teleconference. God bless you. And again, it was a very, very successful program, and had a lot to do with the flooring of the Cold War, bringing together all these for the first time, the Russian and the American space physicians. The meeting was chaired was Eugene Cernan. He was the co-chairman with me, and he was the last man to walk on the moon on Apollo 17. He died about a year ago. Next slide, please. And again, some of the issues that described Hillary when she had her fainting spell while she was campaigning in New York City, again, made the New York Times that she was critically ill, but clearly that many things are exaggerated by the press. Next slide. And again, one of our patients, we actually took care of him in our hospital, and you know who he is. Next slide. Again, so through these interactions, I got to know, again, many of the presidents. And there should be discussion about presidential candidates' fitness to serve, but pure media and public obsession with the physical health of the candidates has been widely exaggerated and speculative. Somebody shouted out Trump's mental health. On health transparency, both campaigns seem to have stumbled in the heat. Now, there is not an obligation of the president, of the candidate, to divulge his health history. In a way, he has to give permission for it. And in recent years, every presidential candidate, Democratic and Republican, has given their health history, as much as they wanted to release, but some health history, except for Sarah Palin, who refused. But every other candidate, at least over the last 50 years, has made their medical history available. Next slide. So where does things begin with the history of the presidents and the presidential positions? Well, in the United States, the first medical school was the medical school of the College of Philadelphia. It was the University of Pennsylvania. Most of the physicians who started that school during colonial time had studied at the University of Edinburgh in Scotland. And the major schools where Americans could go for medical school training were in Scotland, in Edinburgh, and in Holland. Leiden in Holland. And these are the fathers of the University of Pennsylvania Medical School. One of them is Benjamin Rush. There was a medical school later named after him. John Witherspoon. Rush actually signed the Declaration of Independence. He's the father of American psychiatry, not a president, but certainly someone who was very close to John Adams and Thomas Jefferson. And also mentioned is John Witherspoon, who was signed the Declaration of Independence. Next slide. So starting with Washington, the tradition of care of the first 10 presidents was that it was made by private physicians who were paid by the president. The president actually paid for his or her own medical care. Washington was living in Virginia, and when he was then came from New York to be inaugurated president, it's where the capital was. Washington asked the physician in Alexandria, Virginia, John Craik, I'll show you a picture of him, to come with him to New York. Craik refused. He said, I have a private practice, I'm staying in Virginia. So Washington came to New York without a physician and quickly became the physician of Samuel Bart. Next slide. Who's shown here. Bart was also a graduate of the University of Edinburgh Medical School, and actually had 4 years of college before medical school, and the chair at Columbia of Medicine for many years was named after him. It was the Bard Chair of Medicine. Bard was an interesting individual. He was a Tory during the war, supported the British, but still became Washington's physician And there are bills that Bart sent to Washington that are available for scrutiny. And he took care of Washington through two severe illnesses. One was a respiratory illness, the pneumonia, and it started a tradition. Bart felt he was over his head and had physicians come from Philadelphia to help care for Washington. And that was the beginning again of consultative medicine, but also secrecy. Nobody knew how that Washington was ill, and that the physicians were brought from Philadelphia to help in his care. Washington survived. Again, that he served 8 years as president, went back to Virginia. Next slide. Where Craig, and this is a portrait of him, became his doctor again. James Craig, again, was a graduate of the university, did not graduate from the University of Edinburgh, but attended there for medical school. And his importance in medical history is he was at Washington's deathbed. And in fact was confronted with doing a tracheostomy, opening up. Washington developed a respiratory stridor, he couldn't breathe. Craig knew how to do a tracheostomy, but didn't do it. Instead Washington was bled, which was a popular therapy at the time. Washington succumbed. But Craig was the one who actually pronounced Washington dead. Next slide. This is the picture of John Adams. And the reason now for mentioning these early presidents, they had their own personal physicians, was how long many of them lived. Adams was almost 91 when he died. He died on the 4th of July. Everybody knows this with Thomas Jefferson and the 50th anniversary of the Declaration of Independence, which they both signed. Next slide. This Jefferson didn't believe in physicians. In fact, there was a quote from Jefferson that whenever he saw 2 or 3 physicians talking in the street, that there was a buzzard over their head. He thought most physicians were quacks, but he did actually use smallpox vaccination. He actually had his slaves vaccinated, but again, he himself on a personal level didn't trust physicians. Next slide. But he lived to the age of 83. This is Benjamin Rush, who I mentioned before. He was a friend of Jefferson and Adams, of both of them. And his claim to fame, Rush, again, he signed the Declaration of Independence, but he was the founder of American Psychiatry and the American Psychiatric Hospital. And if you read his writings, he was a very, very humanistic individual who felt the mentally ill should be treated with care and compassion. And he also was a major proponent of bleeding. And there were yellow fever epidemics that occurred in Philadelphia and New York City, where yellow fever, and during the summers when the ships would come from the Caribbean, where yellow fever was treated with bleeding as its primary treatment. But that's, Jefferson thought that Rush was too excited about bleeding his patients, but that was the therapy at that time for yellow fever. And again, he wrote the first textbook of psychiatry in the United States. Next slide.
Before we move forward, I want to remind everyone to mute yourselves. We're getting some background noises.
Next slide. Next slide. This is the 6th president, John Quincy Adams, son of John Adams. Now, John Quincy Adams' claim to fame, as far as presidential health, was he was the first one who really proposed preventative medicine, not to smoke, to exercise. And in fact, Adams, as president, used to swim when the weather was clear in the Potomac River. He would walk from the White House to the Potomac, take all his clothing off, jump into the water. Ultimately, his political opponents got wind of this and they stole his clothing on multiple occasions. And he had to run back to the White House without clothing. So he stopped doing that. But he was one of the proponents of presidential health, lived to the age of 81, probably died of a stroke. Next slide. This is another presidential physician, John Collins Warren, a famous Revolutionary War family. His history is the fact that he was the founder of Mass General Hospital and the New England Journal of Medicine. He was a surgeon who was operating when general anesthesia was first given in Mass General. He was actually doing the surgical procedure while general anesthesia was given. He was involved in the care of Andrew Jackson, where Jackson was on a political tour, and Warren consulted on him, and he removed a bullet from Jackson. Jackson was a dueler, and what's an interesting thing about Andrew Jackson, Jackson had the lowest body mass index of any president. It was 18. He was 6'1", 145 pounds, and that's where he got the term Old Hickory, because he was so thin. And but was involved in dueling, and it came in handy that he was so thin, because he would stand sideways when he was dueling and would put on a big overcoat. So he survived many potential mortal wounds by being shot in the coat instead of in his body. But sometimes he was shot, and Warren was involved in removing one of his bullets. Jackson lived to the age of 78. Next slide. Next slide. This is William Henry Harrison, the ninth president. Very important because of what's happening tomorrow. We'll see what happens with Biden's inaugural address. Harrison was the oldest president at the time elected. He was 68 years of age. Gave his inaugural address on March 4th, which used to be the time of the inauguration, 1841. He gave his speech in the cold. It was pouring rain for 2.5 hours. He was uncovered, didn't wear an umbrella, and gave the longest inaugural speech in history, 2.5 hours. And then came to the White House, got sick, and died there. In fact, his wife never made it to Washington. She was on her way. She missed the inauguration, and by the time she got to Washington, Harrison had died. And he died in the White House. At the time, although there were hospitals, because of the fear of infection, people were treated at home. People delivered their babies at home, and Harrison died at home in the White House, living 1 month as president. The longest inaugural speech in the cold and the rain, 1841. Now, his doctors, who were from Washington private physicians, felt that they would be blamed for his death, and wrote an article in the New England Journal of Medicine mentioning that Harrison's death was related to his not taking care of himself. They didn't want to take any responsibility. Maybe felt they would get sued at that time. I don't know. But Harrison, again, was the oldest president, and at the time, and only was president for 1 month. John Tyler became the president on Harrison's death. Next slide. Next slide. Next slide. Skip these slides. Next slide. This is the 11th president was James Polk. And Polk was interesting. He did a lot of travel. He was the 11th president from North Carolina and Tennessee. He was known as Young Hickory. He was a protege of Andrew Jackson. And because Polk traveled a lot, and he couldn't get a physician to travel with him from Washington, he set the precedent of having a military physician whose name was Jonathan Fultz. Next slide. Next slide. And this is Jonathan Fultz for medical history trivia, the first presidential physician from the military. And from that time on, the president would be assigned military physicians. Again, Fultz is from the Navy and accompanied Polk on many of his political trips. But again, the president could still have a private doctor that he paid for, but was assigned a military physician, and Fultz is the first one. Next slide. This is Zachary Taylor, actually wearing uniform, was a 12th president, died also in Washington, in the White House, probably from cholera, after an intestinal illness, after a summer party on the White House grounds, developed severe abdominal pain, diarrhea, and died. It was interesting about Zachary Taylor. He was exhumed not long ago because there's always was a question whether he was poisoned. And during his exhumation, they found no evidence of poison. Interesting. Not again exactly a cause of death, but it's most likely was cholera that he died for. And like Harrison, was not treated in the hospital, was treated in the White House. He was the second president to die in the White House. Next slide. Keep going because of time. Again, Abraham Lincoln. Lincoln's health and history is sort of interesting. They thought he had a disease called Marfan syndrome, a congenital illness that affected the heart and blood vessels, but not so. Lincoln was actually autopsied, and they've really found no evidence of Marfan's disease. Of course, died of a bullet wound from being assassinated, but it was actually in relatively good health while he was the president until his assassination. Now, his physician, next slide, he had two, was a fellow named Robert Stone, who was a private doctor, an ophthalmologist, an eye doctor, who was the first one to use an ophthalmoscope in the United States. Actually brought the technique to the United States. And he also took care of Mary Todd Lincoln and the Lincoln children. Next slide. Again, the assassination, next slide. And Joseph Barnes, who was Lincoln's military physician, declared Lincoln dead. And in the rooming house where he was brought, again, not to a hospital, they brought him to a rooming house where he died within a day of his death. He was shot on Good Friday. This is Barnes. The interesting thing about Joseph Barnes was he was also Garfield's military physician, who was also assassinated. So he had a sort of an interesting experience being involved with two assassinated presidents, but again, a military doctor. Next slide. And Garfield, who was shot on his way on a train going to New Jersey, where his family was staying for the summer. And James Blaine was with him. He was shot at the station in the back, lived 2 months, actually died in New Jersey, where he was thinking that the weather would actually help him by the ocean. Garfield died of an abscess. His wound was fingered. It was a time when there was a competition between homeopathic physicians and allopathic physicians, which took place with Garfield. In fact, the allopathic physician Carrington was a fellow named Bliss. Next slide. And the homeopathic physician was Susan Edson. Next slide. One of the few female physicians at the time. And there was constantly bickering and fighting about the care of Garfield. He probably died of an abscess and sepsis. And the Walter Reed Armed Force Institute of Pathology, they have Garfield's spine there. And again, there was an abscess that went from his abdominal area right back into his spine. Again, died of septic death 2 months later. Now, Garfield would have survived today with the use of antibiotics and antisepsis. His wounds were not mortal. They became mortal because of the care being given at the time. Next slide. Garfield also never went to a hospital. Here's one of New Jersey's favorite. And, speaking at the Medical Society, Grover Cleveland, who was born in Caldwell, New Jersey. The son of a minister, but his political career took place in New York, where he was mayor of Buffalo and the governor of New York State when he became president of the United States. Now, Garfield, Cleveland was interesting because he developed a mass in his mouth. And his presidential physician, next slide, felt it was cancer, that it needed to be removed. This is actually Richard O'Reilly, who was his presidential doctor from the Army, his epaulets and medals present. Cleveland was operated on a ship, a boat. It was during the 1890s. It was during the time of a depression in the United States. People were afraid, if they knew about Cleveland's illness, that a panic would set in. In fact, it was a panic of 1894. So Cleveland was operating on a ship in secrecy. The individual who did the operation was Joseph Bryant. Next slide. Who was in the chair of surgery at NYU, at the Bellevue Medical School, and actually did the operation on the ship. There were no nurses, only crew members. Nobody knew, everybody was sworn to secret. It was many, many years, almost 40 years before people knew about Cleveland surgery. He was already dead. He actually died in Princeton in 1908, not from the tumor. It was an omantoblastoma, which is a precancerous lesion. Next slide. But again, the area of the the whole thing of presidential health secrecy, keeping it from the public. But if the president didn't make extra money by doing commercials for tobacco companies and here for beer, this is Benjamin Harrison, 23rd president, sitting with Grover Cleveland in this advertisement for Schlitz beer. Next slide. And that's an important issue because of the fact that the health of the presidents in the 19th century was not as good as the health of the presidents in the 18th century. Part of it related was the fact that people smoked, drank more, and both the use of chewing tobacco and cigarette and pipe and cigar and cigarette smoking. McKinley was also assassinated, the 25th president. Next slide. This is his physician, Presley Rickson, who was a Navy doctor, but here in civilian clothing, and was involved also with McKinley's assassination. McKinley was operated in a tent outside of the hospital because, again, they didn't put the president in the hospital. He was operated in a tent by Roswell Park, was one of the surgeons. Roswell Park had a cancer hospital named after him in Buffalo. Not a park, it's actually the name of the surgeon. But again, a tradition, he was a Navy doctor, where many of the presidential physicians came out of the Navy. Next slide. Again, his assassination. He died 6 days later. Again, not a mortal wound. He would have survived if there were antibiotics available. He died of peritonitis. Next slide. Being shot in the abdomen. William Howard Taft was the heaviest president, had the highest body mass index over 40, which would have made him a candidate for surgery, weight-reducing surgery, having a body mass index that high. I mentioned Jackson's body mass index was 18. Taft's was over 40. And by the way, Teddy Roosevelt had a body mass index over 40. Despite his sort of activity, he had obesity, Teddy Roosevelt, and actually probably died of a heart attack in his sleep at the age of 60. Now Taft, next slide. He's playing golf, next slide. This is probably the most famous presidential baseball photograph that you'll ever see. First of all, there are women in this is 1912, where Taft's throwing the first ball out. Now, what happened in this game, in the 7th inning, Taft had to go to the bathroom, left his seat, and out of respect for the president, it was the bottom of the 7th inning, everybody in the stadium stood up. Everybody stood up. And this is where the 7th inning stretch comes from Taft going to the bathroom and everybody standing up in the bottom of the 7th inning. Next slide. Presidential bathroom. Next slide. Now, in the next few minutes, I just want to sort of highlight, again, further 20th century events. This is Woodrow Wilson, again, a former governor of New Jersey, a Virginian, got in some political trouble recently because of some of his political beliefs. But Wilson was, again, president during World War I. This is with his second wife, Edith Galt Bowling. His first wife actually died in the White House, and he remarried. And after World War I, Wilson was trying to get the United States into the League of Nations, felt it was very important for world peace. Now, Wilson was a hypertensive, had high blood pressure. There was no treatment for Wilson. There was no treatment for high blood pressure. He actually had a hemorrhage in his eye, probably related to his blood pressure, that healed. And Wilson went on a campaign out west, trying to get people to support the League of Nations. He had a mild stroke in Colorado, came back to Washington by train, and had a major stroke, which left him with cognitive disorders, paralyzed, eye findings, and it was kept completely a secret. Completely a secret. And the feeling was that the government was run actually by his wife. The vice president didn't even know how gravely ill Wilson was. Wilson did recover somewhat, died ultimately of another stroke after leaving the White House at the age of 67. Now, it's interesting, had there been therapy for Wilson, perhaps we would have been in the League of Nations and World War II may not have occurred. Sort of one of the historical questions. But again, his health was kept a secret. Next slide. Carrie Grayson was his presidential physician who kept the secret with Edith Galt Bowling and also was involved in helping to run the country. If one had to say who was the only presidential physician to help run the country, it's Carrie Grayson, who was also a Navy doctor, but was involved with the secrecy of Wilson's health. Next slide. Quickly, Warren G. Harding, who died at the age of 58, probably of a heart attack and perhaps a stroke, was on a trip to Alaska or the West Coast, started having shortness of breath, was not brought to a hospital. This is already 1923. Was brought to a hotel where he died after a few days. Next slide. And this is an interesting presidential physician, Charles Sawyer. Interesting for one reason. Sawyer was a homeopathic doctor who Harding wanted to bring as the presidential physician. Sawyer was a civilian, insisted that he be made a general, or else he wouldn't come. And this is the only time in history in the United States where a citizen automatically became a general. Next slide. And was involved in Harding's care. Here's Harding with Laddie Boy, his dog. I have another talk on presidential pets. Laddie Boy was interesting. He's the only dog in the Smithsonian Institute. Of course, he's stuffed, but he's there. And this Laddie Boy was Warren G. Harding. Next slide. President Harding died suddenly, stroke, apoplexy, Calvin Coolidge as president. Coolidge served 5 years, retired in the early 1930s and in 1929, and died in his sleep also at the age of 60, like Teddy Roosevelt, probably of a heart attack. Coolidge happened to be a heavy smoker, as was Harding, who died at the age of 58. He was a heavy smoker. He also chewed tobacco. Next slide. This is Calvin Coolidge as president with his two sons, their dog. The son to the left of Coolidge died of bacterial endocarditis. There was no antibiotics available while Coolidge was president. Next slide. Now, this is one of the my favorite presidential physician, Joel Boone, who graduated of Hahnemann Medical School. Boone is one of two physicians to get the Congressional Medal of Honor for extreme bravery. Only two physicians got it, Leonard Wood and Joel Boone. Boone was a Navy doctor, was assigned to the Marines. Marines took care of the Navy took care of the Marines. He was sent to Europe, where he was involved with the Marine unit, and allegedly pulled out of from the battlefield 20 individuals single-handedly, and was given the Congressional Medal of Honor. Became the presidential physician for Calvin Coolidge and for Herbert Hoover. Next slide. And finally, because I want to have time for questions, maybe we'll discuss two other presidents quickly. FDR, shown here with one of his sons. Roosevelt was a polio victim, or perhaps had Guillain-Barré syndrome as a cause for his paralysis, which occurred in the 1920s. Interesting thing about Roosevelt, when he spoke, he was always at a podium, and that's when photographers took pictures of him, always standing up, holding the podium. The photographers never showed him in a wheelchair or seriously impaired. He was propped up with braces at the podium, where then photographs would be taken. Next slide. This was his presidential position, and this is what's the who was a gastroenterologist, an ENT physician, an otolaryngologist, shown here. And Roosevelt picked a Navy doctor. He had been Secretary of the Navy under Wilson, Assistant Secretary, and McIntyre treated his sinus condition. That's what Roosevelt's major complaint was in the 1930s, was his sinus condition, and he picked an otolaryngologist to take care of him. But Roosevelt was also a severe hypertensive, had a blood pressure for the last years of his life of 160 over 120. There was no treatment available for Roosevelt except for phenobarbital, barbiturates. Next slide. Howard Boone was the cardiologist. Because McIntyre couldn't handle Roosevelt's hypertension, Boone, a cardiologist who eventually practiced in New York, was assigned to him, was actually with Roosevelt when he died in Warm Springs, Georgia in 1945. Next slide. These are pictures of Roosevelt's cardiogram. Roosevelt was also suffered from heart failure, and in fact, during his fourth term as president, he didn't attend the convention. A lot of it's because he was very ill at the time. He was in severe heart failure, had been put on digitalis by Howard Bruin, and probably should never have run for his fourth term because of his grave illness. He had renal disease, probably related to his hypertension. Next slide. Next slide. Again, the cardiogram. Next slide. Next slide. Roosevelt in Yorkton in February of 45, looks ill, has a cigarette in his hand, was a heavy smoker. Stalin and Churchill. They all smoked, actually, all three of them. Roosevelt was a heavy smoker, and again, he had his high blood pressure. Next slide. And people felt that Roosevelt made mistakes, that he also politically. This is when he returned from the oath to the United States, could no longer stand at a podium. He sat for this and talking to Congress after his return to from Yalta. Next slide. Roosevelt's Day of Death. He was sitting for a portrait in New Orleans, Georgia, where he went for care of his paralysis. While the portrait was being painted, he complained of a severe headache. Said it was the worst headache he ever had, and within an hour was dead. Howard Bruin was called and took his blood pressure. It was 320/190. That was Roosevelt's final blood pressure, and he probably died of cerebral hemorrhage. Eleanor Roosevelt refused an autopsy. Next slide. Just to show this, just for medical history trivia, is Harry Truman, who was the first president to be hospitalized. He was hospitalized for pneumonia. Before then, all the presidents with their illnesses, including Roosevelt, were treated at home, or maybe went to a doctor's office, but never in a hospital. Next slide. And finally, I'll end with Eisenhower, because this raised actually a great controversy. Eisenhower was a very heavy smoker. He actually stopped smoking because of raspiness of his voice, and when he became a politician. But again, was a heavy smoker. When you talk about D-Day, he was lighting one cigarette after another. Next slide. And in 1955, had a heart attack. The first actually documented myocardial infarction in a president. It was 1955. Eisenhower was in Denver, Colorado at the time, visiting his in-laws who lived in Denver. Mamie Eisenhower was from Denver. He played golf that day that he got sick, and at night complained of chest pain. His doctor, Howard Schneider, an army doctor who took care of him also in Europe, got panicked, seeing Ike so sick, didn't know what to do, and told Eisenhower to stay in bed, and he'd come back the next morning, which he did. Eisenhower hadn't gotten better, still having chest pain. And they walked Eisenhower to a car and brought him to Fitzsimmons Army Hospital, which was in Denver, and he spent 6 weeks there. And one of the things I remembered about Eisenhower was in third grade in public school in the Bronx, all of us having to say a prayer for Eisenhower's recovery. It was 1955 from his heart attack. Nixon would have been the president, and Eisenhower succumbed. And I just want to end with the next slide, then we'll take questions. This is Howard Schneider, an Army doctor, of course, Brigadier General, 1-star. And of course, Eisenhower would have picked an Army doctor to take care of him. But he also, Eisenhower, next slide, had a cardiologist named Thomas Mattingly, who wanted Eisenhower to retire, not to go back to the White House, but to retire as president. That was his recommendation as Eisenhower's military cardiologist. And this is where a great controversy occurred. A civilian consultant was called in. I actually, first time, had that role for the Army, and the civilian consultant for the Army was Paul Dudley White. Next slide. From Mass General, who argued that Eisenhower could run again for president, which he did in 1956. And so this was sort of a controversy between civilian and military physicians. White recommending that Eisenhower run, which he did, and he survived. Next slide. And this is actually showing 1955 with 6 weeks of bed rest that Eisenhower had, and more recently with people to spend a few days in the hospital. Next slide. While he was in a secretary, Eisenhower actually had a mild stroke, considered resigning, recovered, and finished his 8 years as president. But I want to sort of end with a natural history experiment that's taking place. I mentioned that the first 10 presidents lived for the most part, very long lives. And in fact, Harrison was 68, lived the least amount of years, but Madison was 85, Jefferson 83, Adams 91, Van Buren was 80. They lived long lives. The presidents that went in the 19th century, the early part of the 20th century, lived a much shorter time. Not so much dying in office, but not living long. More recently, the presidents have lived very long lives. Ford was 93. Reagan, although he had Alzheimer's, was 93 when he died. George Bush, the father, was 94. And Jimmy Carter is going to be 97 next October. And still running around. Next slide. Next slide, next slide. That's going to end. Next slide. Keep going, keep going, keep going. Keep going, it's going to end. Lyndon Johnson died of an MI at the age of 64 after he left the White House and had severe coronary disease on his autopsy, a heavy smoker. Next slide. And back to variable, next slide, next slide. Next slide. Keep going. Next slide. Next slide. Next slide. Next slide. There's Gerald Ford in good health. And finally, Jimmy Carter, next slide. And I'll end with this. He was 96 in October. Again, will be 97 next October. What was interesting about the president, more recent president, that none of them smoked. Reagan didn't smoke. Bush, the father, didn't smoke. Carter doesn't smoke. And Gerald Ford didn't smoke. So it's interesting. We've seen this natural history. The early presidents didn't get great medical care, but perhaps took better care of themselves. More recent presidents in the 19th and 20th century who died earlier, and more contemporary presidents living long lives because they don't smoke. And that sort of natural history experiment with the history of the presidents. And the final question always comes up: how much secrecy should be involved in presidential care? And maybe we can take it up into discussion. And when the 25th Amendment should be introduced as a way of removing a president because of a mental or physical impairment. And I'll stop now, and I thank you very much for having me speak tonight.
And again, thank our speaker tonight. Thank you for coming.
Yes.
And
Yes. Okay, thank you, thank you.
Thanks,
Thank you all. Thank you. Thank you for having me.
Thanks, Dr. Frishman.
Thank you.